All right, so now we're going to get into brain functions. So we're going to talk about memory and learning, talk about long versus short-term memory, cognitive processes, and then we will get into some disorders, some of which we've kind of briefly talked about, like a stroke, TIA, Alzheimer's, Parkinson's, and epilepsy. So what is memory and what parts are involved with memory? Again, memory is just your ability to recall something, whether it's in the short term or the long term. This is going to involve a lot, right? Memory is complicated, so it involves the temporal lobe, the hippocampus, the caudate nucleus, the dorsomedial thalamus. The amygdala is involved with learning fear responses. So if if someone were to, like, every time you made a mistake, they were to shout at you, right, you would develop responses and remember responses. So if you made that same mistake, right, you would anticipate the shouting, right? The prefrontal cortex, this is for more complicated problem solving, as well as working memory, which is short term, like right now, remembering the words I'm saying as I'm saying them kind of memory. The left inferior frontal lobe is going to be for math, and then semantic memory, and then hippocampus will be for new information, and then making the transfer from short term to long term. And then temporal lobe is going to be for long-term visual memory. So I've been talking about short-term versus long-term memory, but really what does that mean? So short-term memory is recent information. It's the fact that you're able to remember what I said on the slide we just went over, right? So like, what did we talk about? Oh, we talked about what parts are involved. So you're remembering, like, we just talked about what parts are involved with memory. Long-term memory is going to be like minutes, hours, days, weeks, years later, right? So short-term memory is like right now. What do you need in these moments, right? While this situation is ongoing. Long-term, right? This is when we're looking at, hours later, days later, weeks, months, years later. Right? And we can convert short-term to long-term, right? Transferring to long-term is done through memory consolidation, and in order for that to happen, you need sleep. Oh man, I'm gonna call some students out right now. So this is one of the reasons why doing something like cramming or staying up really late, not sleeping well, can hurt things like your ability to study and remember things long-term. So super important, right? Even though I know you have a lot to cover, and especially, as you move on towards taking the TEAS exam or trying to study in a nursing class or whatever, sleep is very important for you to actually hold on to those memories. So you have to get sleep for your studying to actually be effective in the long term. So something to think about, right, when you are developing your study plans and whatnot. Long-term memory, right, this is where we are forming new synapses, and there's a couple different forms of long-term memory. There's non-declarative, which is procedural. This is like how to do something. So like how to, hold a fork to eat your food, or how to ride a bike, right? Those types of things, like simple skills to perform a specific task, like how do you hold your pencil. Declarative, this is like things that you can verbalize, right? So semantic would be like memory of facts. So we think like you're talking about very, very straightforward, like if you memorized a poem, right? Or you memorized, how many people are on the planet right now, right? It's very straightforward. It's usually like something to do with like language or numbers, like it's rote memorization. So remembering like the names of all the bones, right, would be semantic. Episodic is just events. So remembering that, like, yeah, me and my friends, we went to the beach and we hung out and we had a picnic and we stayed until the sunset and it was really pretty and like all these colors were in the sky. Like that would be episodic because it is more kind of like a story, right, in a way. And there isn't a specific way to verbalize that, right? I can kind of describe episodic in several different ways, whereas if I was regurgitating a poem, right, if I was reciting a poem, that poem would be said in the exact same way every single time because I'm reciting it word for word. Now, People with amnesia have impaired declarative memory, meaning they have trouble, recalling facts, or they have trouble remembering, events that have happened to them. So moving on to cerebral lateralization, this is where we have the two hemispheres, right? Each side of what we call the precentral gyrus, controls, basically like things are going to be kind of opposite, right? It's kind of strange. Some things when we look at this that are linked directly to the central nervous system are going to be controlled on the same side, right? Whereas other things like with the body, right? So things that connect like directly to the brain typically are going to be the same side. Whereas with your body, like arms, legs, torso, and all that, we see control is contralateral. So meaning like your right arm will be controlled on the left side of your brain, right? There's a crossover there. So it's an interesting thing with that, right? The only one that doesn't follow either of those is going to be the optic nerve. So visual information actually uses both. It's both contralateral as well as on the same side. And so that one's a little bit strange, right? But anything that connects directly to the brain like that, we're going to see, right controls right. Whereas anything with the body, arms, legs, things like that, we see contralateral. Right controls left. We communicate between the hemispheres using the corpus callosum, and we tend to see the sides of the brain kind of specialize in things. So like the left typically is going to handle things like language, grammar, and whatnot. Same with the Broca's and the Wernicke's area tends to be more lateralized to the left, but that's again a tendency. It's not necessarily perfection. And also keep in mind that the brain has plasticity. Now, what can go wrong? I mentioned this in another video when I said a stroke, and I called it a cerebrovascular accident. But a cerebrovascular accident, or a CVA for short, or again, what you probably know as a stroke, this is where the part of the brain is being denied blood flow. That's generally what has happened there. And because it's being denied blood flow, that part of the brain is being starved, right? It is not getting nutrients, it's not getting oxygen, and the wastes are building up. So there's a couple things that can cause a stroke. It can be because there is some sort of blockage, so like an embolism, some sort of something blocking it. So something like an ischemic, we're seeing less blood supply because of something has blocked it, something is not allowing blood to get through. Or hemorrhagic, this is where a blood vessel has actually broken open, and so we see bleeding on the brain, right, with that. And so those are the two different types of strokes we see, right? But both of them have a similar effect in that part of the brain is not getting access to oxygen or nutrients and whatnot, and so that brain tissue will die, right, if it is not treated. Strokes, the outcome of a stroke depends on a couple things. One, where is it, right? How severe, what type and how severe is that? And also time. How long did it take to get medical care? There are certain things that we can do to treat strokes that are extremely time sensitive. We have to get to a hospital as soon as possible, and we can only provide that treatment within a certain window. After that, we have to rely on other things to treat a stroke. And so time is of the essence. If you suspect you or someone else is having a stroke, absolutely it needs to be treated like an emergency and needs to be treated at the ER, right, for sure. So some things that you may have heard, like a fast face drooping, arm drooping, or face is drooping or arm is drooping, slurred speech. Those are things that tend to happen. So you see like one side of the face, it usually affects one side of the body, but you'll see like the eye or they can't smile on that side of their mouth. So we see that. We see things like that arm kind of drifts downward on the side, on the opposite side that's being impacted. So like they would have weakness, they wouldn't be able to use that arm, and even their shoulder would kind of drop. And then speech. So it could be slow or slurred speech, almost sounding like someone might be drunk. But it could also be word salad where like they're saying things and it doesn't make sense, right? Like that doesn't, their speech is fine in terms of understanding the actual words, but the words together don't make sense. All of that leads to T, which is time to get to the emergency room. You need to get that person help right then and there as soon as possible. Something else that can happen is what's called a transient ischemic attack, or sometimes called a mini stroke. This is because of impaired blood flow, right? So similar cause, so it could be a blood clot, a blood disorder, atherosclerosis, right? And so we do see similar symptoms, so dizziness, weakness, numbness, the drooping on one side of the face, the paralysis or the drooping of a limb on half the body, the problems with the slurred speech, or maybe they're not even understanding what you're saying. They may have issues with vision too. It can be sudden and it only lasts for a few minutes. And then all of a sudden they seem like they're fine. That's why it's transient, right? It's not happening long term. But this is basically you can think of it like a precursor. If someone's having TIAs, they need to get treated because they're at risk, at a much higher risk of having a full-on stroke, right? Because there's a reason they're having these mini ones. And whatever that reason is needs to be handled because they're at risk of a full-on stroke still. And even then, the symptoms for a TIA and a full-on stroke are the same. So if you notice these symptoms in anyone, that is emergency room worthy because you don't know if this is going to be transient or not right away, right? You're not going to, while the symptoms are going on, you're not going to know whether or not these symptoms are going to stop in a few minutes or not. So this is something you should still treat as an emergency because again, with strokes, time is of the essence. As soon as these symptoms pop up, this needs to be taken to the emergency room because like I said, some of the treatments for things like strokes are very time sensitive. They have to be given within a window. The next one is Alzheimer's disease. This is a neurodegenerative disease that is related to things like dementia. This is going to be just widespread impairment within cognitive abilities. And so this person with Alzheimer's would have intellectual impairments. Things like memory would be affected. They would not maybe remember how to do things. They would forget people. Their personality may change. So they would not be able to reason. And eventually they lose the ability to care for themselves. So people with like Alzheimer's or dementia would forget people, like including their loved ones. That includes their own children or spouse. It can include not remembering to eat or not remembering how to eat, right? How to like use a fork. It can cause personality changes so that someone who was very kind and friendly could become very angry and very upset or easy to upset. It can also cause a lot of confusion, which can be very scary for the person experiencing it. And so they may react poorly to changes or to things that they have forgotten, right? So if they forgot someone, let's say they forgot who their son was, they could, because they don't remember the person, they might think that that person's trying to harm them. And so they may, lash out in that aspect. It's a very hard to treat, in not so much in terms of like difficulty, although that is difficult as well because we don't have a cure for this. It's all just treating the symptoms. But it's also difficult emotionally, especially for families and for the patient, because there's a lot of emotional things that go along with it, right? In terms of, that person being scared or that person being fearful or not being able to care for themselves. And then, of course, for the family, having to see their family member go through that and not necessarily be able to be the one to actually help. We have medications that can help treat symptoms, that can help treat the disease. However, that is a treatment that will have to be ongoing. It doesn't necessarily stop Alzheimer's, it just slows the progression, and it definitely does not cure it. But things like acetylcholinesterase inhibitors, glutamate antagonists, right, those are things that we can utilize. And what we see in a lot of people with Alzheimer's is that they lose cholinergic neurons, which is, the cholinergic ones are the ones that are going to release things like acetylcholine, which is why acetylcholinesterase inhibitors can help. And why we see that is because we see these like plaques, what we call amyloid plaques, getting deposited. And now we see these tau proteins getting tangled up inside the neurons as well. Parkinson's is another neurodegenerative disorder. This is going to affect the motor system. So someone with Parkinson's may have trouble with rigidity or tremors. They may have trouble with moving, right? So they may move slower or have difficulty with moving, like walking. There are a lot of different medications. This is because of the dopaminergic neurons being lost. And so we see that dopamine agonists that are going to promote dopamine, right, can help here. This is because of misfolded proteins that turn into Lewy bodies in the neurons. And so that's going to cause the neurons to break down and no longer function. And then epilepsy, this is a neurological disorder where electrical activity becomes abnormally elevated. And so this causes seizures as well as unusual behavior, sensations, loss of consciousness. There are some symptoms that happen between seizures, but usually we see seizures happening kind of like in, I guess I don't want to say packets, but like it is an event, right? Seizures can vary in terms of like, it doesn't always have to be like that kind of Hollywood image of a seizure where the person's on the ground and they're shaking and whatnot. It can include seizures where the person just seems like they've kind of totally zoned out, right? And they're not doing anything at that moment. So epilepsy or seizures can look a little different depending on the type. And in terms of treatments, for some people, like especially if they have a known seizure disorder, a lot of times the treatment is just make sure the person is safe so that they don't fall over or hit their head on something, and just allow the seizure to pass, right? Allow it to occur, allow them, to go through the seizure, and then, take care of them as they come out of it. It really depends on the person's case, and if someone does have a seizure disorder, it's important to listen to them when it comes to what to do if they have a seizure, because more than likely they're going to know what needs to be done if they do have a seizure.